So first and foremost, a very good evening to one and all present out there, sitting in front of your screens, and welcome to COVID Talks. And this is our second episode. And today is indeed a very, very special episode because we have with us two very, very special people sharing the screen with me. Um, a lovely gentleman who needs no much introduction to this community at least, Dr. Sundar, who's been a nephrologist for Manipal Hospital and a wonderful human being, always willing to support the community in whatever way possible. A big hand of applause to Dr. Sundar this evening. And of course, I also have with me Dr. Manohar, a diabetologist for Manipal Hospital. Dr. Manohar has also been very active in the research of the vaccine and how the antibodies work. So today we have both of them to share their views with us on the vaccines. And I'm going to request those of you who have questions to please post your questions on the chat on this Facebook chat itself, and we would like to take your questions today. And today would be just one of those opportunities where you can actually go live and talk to two different doctors and hear their views on the same. So without further delay, I'm going to request Dr. Manohar to please take over and share what he has in store for us.
Thank you, Marian. Thank you, Shankar sir and the Kidney Warrior Foundation. My first tryst with was for being an ambassador for fitness, which I really enjoyed it. While we are warming up, and Shankaran sir is always a role model for all of us. He is my senior from the same medical college, and we work together in the same hospital too. So just as we get warmed up, vaccines, I'll go quickly through this vaccines, how they work and where we are with it now. I'm sorry, some of the slides will be very old. I didn't have time to update them. I stayed out of the COVID ward now. So anyway, if someone wants to take a pre-poll, are you willing to take the vaccine if offered? Yes, no, not sure. You can think about it and then we can come back later. Well, this pandemic has been a devastating stuff. I always quote this Darwin's quote. He said, survival of the fittest. But again, he also had something which not many of us know. He has said that in the long history of humankind, those who learn to collaborate and improvise most effectively have prevailed. So if you do not adjust to the surroundings and you boss around, we may not prevail. So in simple terms, dinosaurs went into extinct, cockroaches are still there. So please learn to adapt. Sanitization, masking, social distancing. I need not retell this. We are in the devastating second wave and it is much worse than anyone's imagination. My view about this is, I always felt this is the human greed. Always the question of economy versus health kept coming back to us. Especially when you talk about lockdown, life versus livelihood is another thing which people talk about it. So ponder about it. I don't know where we are and what we are doing with ourselves. And I always believe in an ounce of prevention is better than a tons of treatment. Again, whenever it happens, let's leave a better planet for the future generation. So these are three of my thoughts what come into it. Edward Jenner is the father of vaccination. I go very fast. I don't want to tell too many things now. And some of the vaccines have therapeutic use also, like some vaccines are used for bladder cancer. Otherwise, many of them are preventive purpose only. And this is a beautiful history of the vaccines. Predates, variola was the first thing to be tried out on, and now a lot of vaccines have come in. Of importance for us is the BCG in 1921. Polio virus vaccines are very important. Everyone has heard people talking about polio virus. They're almost closer to the eradication state of it. Then the Ebola and then new the Corona one. Why do we need to vaccinate? Yeah, it's herd immunity or indirect or population immunity when we look at it. If you allow everyone to get infected, even if it is a minor amount of people who have succumbed to this illness, it would still be a large amount of people if you keep our demography in mind. So other way of providing herd immunity so that one person won't transmit the infection to many others is by vaccinating them. So vaccination is important. This is another question, unfortunately, people ask, will vaccine work? This slide emphasizes, re-emphasizes, overemphasizes. Definitely it works. Look at this polio and diphtheria round below into your screen. It is 100% protection, and more than 90% protection has been offered for various other diseases. And I think I'll skip few things. There are multiple types of vaccines. Um, so vaccines types will come to it. It usually will be a part of the virus or the whole virus which is killed, and it is inactive. And when injected or given orally, based on what type of vaccine we have, it elicits a response, but it doesn't elicit the disease. So later, when you are challenged with the disease itself, we have some memory here. Memory cells are active and they fire antibodies more effectively. That's why it will make the disease less severe. So vaccination may not reduce the number of cases, but definitely it reduces people who are getting admitted, who are getting into ICU, who are losing lives. So please do not debate, vaccinate is my message there. So one part of the protein is, as you can see, and then antibody form. So when you are exposed to the organism again, then people can develop immunity faster. Individually, if you can vaccinate, there are certain group of people who cannot vaccinate. So if you put the clusters of people who are vaccinated, who suffer from the disease, it's a faster way to achieve herd immunity. Okay, and I think I'll try to take more questions and make it interactive. So this is one of the problems. See, for example, in the last 6-8 months before, when someone thought about vaccine, people are telling why the vaccine is not coming. We need it. It's such a pandemic, such a disaster. But when it came, suddenly same people started asking, oh, it has come so soon. Should I really take? Is it really good? And so on and so forth. Why did people think about it? Yeah, they are right. The fastest vaccine till date is of measles, which took 8 years. So if you look at this phase, any vaccine or any drug for that matter has to go through clinical phase, preclinical phase, phase 1, 2, 3, and then the approval happens. So preclinical studies, clinical studies, phase 2 studies in a larger population, phase 3 trials to look at efficacy and safety in a structured manner, and then phase 4 post-marketing also. We keep on looking at whether the vaccines work. So this is how it is. But in the pandemic, if you look at it, even the lower half, this was accelerated, but never compromised to the extent what people are imagining. What happens if you look at this, almost 10 years it takes to get a vaccine out. We got it in a year or so by accelerating, but anyway, many places it was meticulously seen that we don't have any serious adverse events. So please be reassured about it. Again, 2 doses, some people debate why 2 doses. First dose gives a response, and usually it wanes. When you give the second dose response is usually good and lasts for much longer time. That's why some vaccines have 2 doses. Many vaccines have single dose also. So routes of vaccine, some vaccines are given IM, some are given subcutaneous under the skin, how you take the insulin. Some are given orally also, like the oral polio vaccine. So each vaccines are given in a different way. And again, I'll just allude to this. A lot of people know it by now, like Pfizer vaccine is available, Moderna vaccines are available in the US, AstraZeneca collaboration in the UK and also in India. What most of us use, Covishield, is from the AstraZeneca collaboration from India. And if you look down, the Bharat Biotech has Covaxin, which is the indigenous Indian vaccine, which is also available now, and a lot of people are using it. Again, I will not go into details. How do you prepare vaccines? Some are called virus vaccines. Some are proteins, which are part of the virus, which are taken and elicited the immune response. Some they use viral vector vaccines, which is Covishield, where they use the chimpanzee adenovirus to act or look like coronavirus. So body's immune response triggers it. It will be very similar between these two. So when you get the exposure to a coronavirus patient, you have better immunity because of better memory. So adverse effect, this is one of the most important things. People overdo it. There are adverse effects with all vaccines available, not just this COVID vaccines, but these are the talk of the town now. That's why 0.5%, it is a quite high number. So most of it is local reactions for the injections. Some of us can have fever, body ache, swelling of the lymph nodes, cold and cough, which passes off in 48 hours. So very rarely neurological complications are described. Some people are also, I think, I'm sure the questions will come up and we can discuss it in later. But side effects or adverse effects are common to all. Even if you read the label of paracetamol, you will not take it. I bet you. So please go back and read the label of paracetamol, not to get scared, but we use it so easily. But when it comes to vaccine, especially COVID, we think 100 things about it. So common ones are these: injection site reaction, tiredness, headache, body ache, chills, joint pain, fever, which disappears over 48 hours. But post-vaccination, there are a lot of beautiful social media messages like someone kicking a train. No, we are not going to be superheroes after vaccine. We still need to continue precautions post-vaccination because, as I said, post-vaccination, we get immunity towards serious adverse events with related to the COVID or hospitalization or death will definitely reduce, but we may still contract the disease and pass on to the other people who are our near and dear ones. I skipped all these things because these are all things in place. The government has done a reasonably good job to send the vaccine to the place, but now we are seeing a lot of shortages in a large country like this. Shortages are expected. So now people always ask which vaccine is good. Both vaccines, where I refer to Covaxin and Covishield, are both effective and safe. The slides were a few weeks old. Now we have some evidence definitely with Covaxin also. Covaxin is an inactivated virus. Covishield is a part of the virus which is called as, and which was mounted on a chimpanzee adenovirus. So it is a vector vaccine versus a killed vaccine. Hospitalizations, we have seen so far the great benefit. People who are healthcare workers who are immune, and there are less and less of hospitalization people who have taken the vaccine. So key message: vaccines are the power to protect against vaccine preventable disease. There are few diseases which we are eradicated. They are safe and effective. History says that all ages vaccines are safe. Get vaccinated, protect your own self and those around you. Please do not debate too much. Don't debate, vaccinate in most cases. In special circumstances, definitely talk to your treating doctor. So now again, we come back to the post-take poll. You people can just ponder over it, whether this small presentation has made any change in the way you look at the vaccination. So if Marian permits, I'll stop sharing the slides and we can go on to the question answer session. Marian, you're muted.
Yes, Doc. Thank you, Doc, for taking us through that presentation. And before we go on to the Q&A session, I would like to hear Dr. Sundar's views on the vaccination.
Thank you, Marian. And after listening to Manohar, I don't think I have much to say, but nevertheless, I think what is important is, if you look at vaccination, it has been there, as Manohar said, for the last 200, 300 years. And one disease I was just reading about, smallpox. Smallpox has been there for 10,000 years, 10,000 years. And the vaccination took, and the disease actually killed 500 million people. And only in the 80s, it got eradicated. The last case was from India, eradicated. But actually, I was reading the person who was responsible for the vaccination of smallpox, a fellow called Dr. Larry Brilliant. I was just reading his book. He has written a book called Brilliant Outcomes, and he talks about how vaccination is important. He was a doctor, a hippie, who came to India, and then he went and became a follower of a Baba in the Himalayas called Neem Karoli Baba, who was also a mentor for Steve Jobs, Mark Zuckerberg, you name it, Julia Roberts. All of them were mentored, or they were followers of Neem Karoli Baba. Neem Karoli Baba actually told this hippie doctor, "You know, doctor," he told him when he came there. So he said that I'm a hippie, and my mother also thought I was not a doctor. You know, doctor, you know, doctor. So he thought, he's saying I'm not a doctor, but actually what Neem Karoli Baba was saying was, UNO doctor, you will become a United Nations office doctor. So Larry Brilliant joins United Nations, works with United Nations, and he actually talks how the vaccination has changed the entire spectrum of smallpox. We don't have smallpox today because of that particular vaccination. So there is no question at all, as Manohar has very elegantly put in all his slides, to say that vaccination doesn't work or is dangerous is something I think criminal in my opinion. There are side effects to everything in life. People tell me there is allergy. And when I was a medical student, I used to read a textbook of pharmacology by a man called Dr. Satoskar. One of the things on allergy was anything and everything under the sun, including the sun himself, is an allergen. So anything can cause allergy. So walking on the road, we can get killed by auto or scooter. We wear helmet. Despite helmet, people get killed. So does it mean we should not wear helmet? Same way with vaccination. I think vaccination is paramount, especially in this pandemic. You can definitely reduce the mortality. And I'm sure Manohar's study, which is done, is not mentioned on the study. Maybe it's confidential, but unofficially he can tell us. He has done a study on healthcare workers who had vaccination. And we have got our antibody levels done. In fact, I feel confident because of those levels that I am vaccinated, even though I'm not going to work physically, but I'm not so scared now. I know that even if I get the disease, it's not going to kill me. That is definite. People who are vaccinated, and more so with people who have come to the question and answer on CKD, diabetes, transplant, where immunity is low, the vaccine is not going to kill them. What is going to kill them is the disease. The COVID is going to kill. So please do not have vaccine hesitancy. Doctors are there to guide you. And I think it's important for us. I'm very glad that Marian has had this program along with Vasundhara as part of Kidney Warrior Foundation to educate people on vaccination. There are a lot of doubts. In fact, I have transplant recipients who are senior doctors. Just before entering the vaccination hall, they call me and say, "Doctor, please tell me whether I can have the vaccine." It's not that they have so much faith in me. They think if I say nothing will happen, nothing will happen. It's not like that. But that is the reality. I mean, there is so much faith. And one other thing which I learned from Larry Brilliant is the Baba would said, he said that in this pandemic, all of us have to fight together. It's a fight together. It is not Manohar is separate, I am separate, Marian separate, India separate. No, the whole world has to fight together. Then only it's going to work. He said, Sab Eka, all of us are together in this. I think that's what we have to aim now. More and more of us have to work together. Then only this whole disease can be beaten. It is not one person's fault. And people keep blaming government, blaming this. There's no point blaming at this point of time. All of us have to work together. And the question now comes is, even after vaccination, why should I wear a mask? Why should I have? I think that is something we should not go into that detail at all. We have to wear because we have still not reached the herd immunity stage. In a country like Israel, because they have vaccinated all nearly 100%, they are removing the mask. In fact, they have got videos where if you look at the way they are removing the mask, it looks like striptease. Somebody is getting excited just removing the mask. It's like that. That sort of feeling, which is wrong to say, but that is the reality. I think we have to have that sort of herd immunity. It will come only by vaccination. I think we'll go to the question and answer session and we'll make it more interactive instead of me alone talking. Thank you, Marian. Please go ahead.
Thank you, Dr. Sundar. It's always a pleasure to hear your talk. I'm always fascinated by it, how you put information across. But on the serious note, let's move on to the Q&A session. We've been getting a lot of questions on this topic. And Doc, I'm going to start off with the first question. And this is not about the vaccination, but I think it's important that people understand this question. And the question is, when is the right time for a patient to get tested once they know they are down with fever and cold and any of the symptoms? Because many people wait for the third and fourth day where the infection has gone very high and then they are into further trouble. So is there a best time to test yourself when you're down with any symptoms?
I think Manohar is the best person because he's one of the brilliant physicians who deals with COVID. I don't deal that much. I think Manohar will answer this question.
Thank you, sir. Important question now, a very common question. See, according to the scientifically, the test can be positive after 24 hours. But I always tell, test it on third, fourth day. Third, fourth, fifth day is a better time to test than the first, second, third day, because the virus also multiplies in the mind, in the body, and then it has to be made available in the source. But what is more important is when you have fever or cold or cough or sore throat or body ache, please isolate yourself. Okay, so that is most important. You isolate, rest, and if you're feeling otherwise also fine, third, fourth, fifth day is a better time to do the test than jump and do it on the first day, comes false negative, and you go around doing your regular chores and infect everyone around you. So all fevers, all sore throats, coughs, nowadays diarrhea are COVID unless proved otherwise, not to psych us, but for protective mechanism. So that is the most important message here.
I think that's what somebody said. Except pregnancy, anything is possible in COVID.
The other part of it, if you want to me to just improvise in the question, second wave has come, to an extent because of the mutation, but to a large extent because of our carelessness. As Sir said, we will not put it on one person or one political party or whatever. So it is multiplying and it has also changed. So many times we are also seeing someone is COVID RT-PCR or rapid, many tests have come are negative, but still they behave like COVID. And later when they become breathless or someone does the CT scan, when they do it, it comes out to be COVID. So the most important, an ounce of prevention is better than tons of treatment. So when you have flu-like symptoms, including diarrhea, isolate yourself, test it on third, fourth, fifth day. If it is negative and you have still symptoms, please still stay isolated and contact medical help.
Okay. Thank you, Dr. Manohar, for that answer. Coming to this very interesting question that the whole country is asking, which vaccine do I take?
That's the question I think Manohar could answer, but I always tell them, as of now, we've got two vaccines, Covishield and Covaxin. And when I took the vaccine, I had no choice, and it was only Covishield. Then there was a choice, Covaxin. I tell them, take whatever is available, take it. There's no question at all. If there's a choice, I think Manohar will tell me what vaccine you should take. If there is a choice, if you've got a Mercedes and you've got a Maruti, which will you choose? Like that, what do you suggest, Manohar?
Yeah, I think, sir, put it across rightly. A car brand or a shoe brand or a hero, heroine or anyone, each person may like it differently. For us to technically again talk about it, there should have been theoretically a study comparing these two vaccines in a definite set of population, placebo-controlled, randomized, double-blind trial to say which is better and in which circumstances. But we are in the pandemic model, as I showed you in the slide. We don't have time for all those things. Whatever is available, take it, is the most important thing. Slight difference between the two vaccines I mentioned when I was talking to you. Covaxin, the Indian vaccine, is a killed virus vaccine. So some of us think that the whole virus is intact and it is dead. So multiple antigens may be exposed and our antibody responses could be to multiple antigens. Why is it important? Some mutation happens, then still maybe it will work. And recently it has shown that 600 odd viral mutations it can cover is the theory there still. It's not 100% proven. So please don't say I will take only Covaxin. No. Correct. Covishield is towards one or two proteins which are very, very important. And so far there is no dramatic mutations which has happened in this. So it is still equally effective. And if you still have doubt, as Sir said, we all have taken Covishield. We didn't have a choice. Sometimes it is good not to have a choice. You just go and take it.
I agree with you. Even our drugs, you look at diabetes or transplant, we have spoiled for choice. Even ordinary TV channel. Earlier, I had only Doordarshan, I was forced to watch it. Now, 100 channel, I am not watching any channel. It has become like that. But as Manohar said, I think people are now talking theoretically at least. If you listen to the American Dr. Fauci and all that Covaxin may be better for mutations. We don't know. We still don't know. But whatever you get, you take it. And the choice can go with you can consult your doctors or whatever other comorbid factor and take a call. But take the vaccine. That is the gist of the story.
Thank you, doctors, for sharing your views on that question. Our next question will be with regards to transplanted patients. Would you recommend transplanted patients to take the COVID vaccine? The answer is yes. If yes, what are the precautions? What are the side effects to be monitored? Because different doctors have different opinions on this. So can we have your opinions, please? Both Dr. Sundar and Dr. Manohar.
I think I will go first because I'm in the field of transplant for the last 35 years. And what I can tell you is a lot of, I think if you talk to transplant physicians, there is no dichotomy at all. There's only one opinion. All of us are very clear. All transplant recipients should take the vaccine. Now the question comes, a lot of people think there is the side effect of the vaccine. Just because you're having a transplant, the vaccine per se does not cause side effect. You understand? The vaccine efficiency may be less because you're on immunosuppressive drugs, your immunity is low. So instead of working at 100%, it may work only 90%. But nevertheless, if a transplant recipient takes the vaccine, if they ever get COVID, the intensity of the disease is less and they recover faster. So the answer to this in a single word is all transplant recipients, come what may, should take the drug. And by and large, our philosophy is we do not change the immunosuppressive drugs unless there is some other reason. Normally, we don't change. We don't reduce or change the immunosuppressive drugs. And also, they ask about taking oral anticoagulants and that sort of thing. If they are on aspirin or clopidogrel, we don't stop. But if there are any heparin or something else like that, that may be stopped during the period of the vaccination. The answer, again, is all transplant recipients should definitely take the vaccine. There's no question at all. There's no ambiguity on that. Manohar?
I think it's a comprehensive answer. Again, high-risk group of people are the people whom we want to cover first, isn't it? Uncontrolled diabetics, diabetic with kidney disease, transplant patients, patients with cancer, and severe lung infections. These are the people who should be prioritized. That's what we did in the government, had a priority list for this. So please do take it. The only concern with people who are on immunosuppressants is because their immunity is suppressed, their ability to generate antibodies when you vaccinate could be lesser. Otherwise, there is no other issue with that. It could be lesser, but again, we don't have time to do that study and find out exactly. So for now, all immunosuppressed patients should be vaccinated.
Thank you, doctors. There we have a patient who's 25 years old and says he had a artery thrombosis post-transplant that reduced my survival chances to 2% after transplant surgery. I read that some patients who's vaccinated, some patient vaccines is causing thrombosis, and I'm really afraid to take the vaccine.
I think I must very clearly tell you, the chances of getting a clot after COVID, it's much, much more than what a vaccination costs. Even though I think it's very clearly shown the AstraZeneca virus, there were some instances of clots, which is not more than the active population, if you do the percentage. So in my own opinion, by him not taking the vaccine, if he gets a COVID, the chance of him getting clots and other problems are much more than taking the vaccine. There's no two things about it. Manohar, what is your opinion on this?
Yeah, yes, sir. I think that's the message. People who do not take the vaccine and end up COVID will have a higher risk of clots developing than people who take the vaccine and vaccine-related clots. In fact, I was just looking at it. The risk of blood clots after AstraZeneca vaccine, 4 cases in 10 lakh vaccinated people. It is coming to 0.0004%. After the birth control pills, it is coming to 0.05 to 0.1%. That is the huge number, birth control pills causing blood clots. Smoking, don't ask, it is 0.18%. And COVID itself is 16.5%, especially in those subgroup of people who have other diseases, who underwent transplant, who are diabetic, who are hypertensive, who have cancer. So COVID infections risk of thrombosis is 16%. Vaccination risk is 0.0004%. Choice is yours.
So definitely there is evidence to show and the literature to show that vaccination is not going to cause the clots. The chance of getting COVID is high in a transplant recipient because immunity is low, and the clots after that are more dangerous. So this person should not worry about that and go ahead and take the vaccine.
Thank you, Doc. The next question is for newly transplanted patients. When is it recommended to take the vaccine after their transplant?
See, normally we would say even after any surgery, about 6 to 8 weeks minimum you wait after the transplant and then take the vaccine. I think even for other surgeries, Manohar, normally you give, how long do you suggest?
Yes, sir. 2 months.
2 months. Same thing with the transplant also. I would say 8 weeks you wait and then take the vaccine.
So for newly transplant patients, the number could be take the vaccine after 2 weeks post your transplant?
Not 2 weeks. 8
2
weeks.
months.
2 months, yes. After that, yes.
Okay, doctor. For a patient who had COVID, what is the ideal time for them to take the vaccination post their infections of COVID?
I think normally I suggest 8 weeks. Manohar will know better. I think is
two parts of it. One group says, why should I vaccinate? I already had the disease.
correct.
Okay, so I'll elaborate a bit. So some of the diseases can give long-lasting protection. Like it was told that measles and chickenpox sometimes can give a lifelong protection. But if you look at some other diseases like H1N1 or the common influenza, it doesn't give lifelong protection. Maybe 10 to 12 months is the protection. So here, if you remember, H1N1 came a few years back and we had a vaccine for it. Now we have the vaccine as a quadrivalent vaccine. Means 4 subtypes or 4 mutated virus are put in the flu shot what we take annually. Similarly, COVID also we may later end up with multiple strains in the vaccine. Now we have only one strain which is there in the vaccine. So I'm sure going further because it's mutating, we are 100% sure it is mutating. So we will have mutant strains studied and be added in the vaccine. So when the virus is changing its color and structure and evading our host defense, we should have vaccinations. For now, the thing is, after 2 months after the COVID infection is suffering, post 2 months is the time to vaccinate. And if someone is asking booster, for the available evidence, I think 10 to 12 months we might have to take the booster, but still the verdict is not out.
Okay, Doc. Doc, another add-on question, the same thing is, so if you had COVID and then if you take the vaccination after a period of time, before that, do we have to do any blood work and then take the vaccination? Would that be recommended?
Not really
That's a good
required.
question.
Not really required. There are certain things which are floating.
CRP. CRP is the way.
COVID vaccine. Should we do CRP? Going ahead,
I think it is solved by some lab fellows to make money.
Secondly, what if I have asymptomatic COVID and I go and take the vaccine? So if you are trying to stretch your imaginations, and there was a bad myth, I'm sure someone would have seen, a menstrual time, the lady should not vaccinate. So firstly, the menstrual time is a big myth. Please forget about it. Vaccine has nothing to do with menstruation. Even if someone is having menstrual cycles, she can definitely go and take the vaccination. CRP and being asymptomatic COVID is a very theoretical thing to analyze. For now, there is no evidence to suggest that you need to do CRP or COVID RT-PCR and then only go and take the vaccine. Imagine people start doing this. Practical aspects now, people who are suffering from COVID are not having facilities to get the test done or the CRP and other things done. Already we are overburdened and this unnecessary. So my sincere appeal to all of them who are listening is to please circulate this. CRP and RT-PCR tests are not required for a person to go and take the vaccination.
Okay. Thank you, doctors, for giving me that answer. Our next question is from Mr. John, who is 20 years post-transplant and currently his creatinine is on 2.6. And he wants to know whether he's still recommended to take the vaccination.
I think his creatinine and the vaccination have no connection. He's transplanted, he's creatinine 2.5 means he's got CKD and he's on immunosuppressive drugs. More so, he should take the vaccine when he's eligible. And I think he'll be only eligible now after May 1st, because as of now, even though we have been talking, Manohar also has been discussing that people above 18 with comorbid factors should take vaccine, should be given. And as of now, only after May 1st, he'll be eligible for vaccine and he should take the vaccine. This 2.5 creatinine has nothing to do with the vaccination, but he may have doubts on the immunosuppressive drugs he's taking. He continues whatever he's taking and he should take the vaccine. There's no two things on that. There's no ambiguity.
Okay. Doc, the next question that I wanted to ask you is a question that we already had the discussion about, because this question went around in the community for quite some time. Well, a few patients when they went to take the vaccination, they were asked if their immunosuppressant drugs were stopped at least for 1 week for the vaccination to work. And yes, you've given me the answer. We also publish it on the Kidney Warrior Foundation page. However, I'd like you to address this question about altering medicines when it comes to the vaccination.
See, I think that immunosuppressive, they're getting confused. In a transplant situation, immunosuppressive is lifelong and you cannot change it. Unless it's a life-threatening infection. Even there, we don't stop it. We give some drugs. But that is not the story with people who got some rheumatic disease or rheumatology or arthritis. For that story there is different. So they should not get confused. So I'm giving you a clear message. Any transplant recipient on immunosuppression, they should not do anything to the immunosuppressive drugs. They cannot change. They can just go and take the vaccination. But other immunosuppressive therapy for other disease, I think Manohar will be the right person to answer.
So other diseases like rheumatoid arthritis, which is fairly stable. So the consensus is if it is a stable disease and is an immunosuppressant other than the transplant patient, we can try and get down the dose to the minimal possible, sometimes alternate days.
Correct.
And sometimes if the disease is very stable, you can be off the vaccine, off the immunosuppressant and restart it post 2 weeks. So if you are transplanted, it is a different ballgame, no change in the medication, as Sir said. If you are on other diseases, the minimal dose required can be kept, maybe alternate day, maybe stopped for about 2 weeks, so that the immune response generation is better. However, please consult your regular doctor. Nowadays, audio-visual consultations also are there because people are worried to come out now. So, and then only take the decision.
Well, on that note, I'm also going to second the last point that Dr. Manohar made. While we're talking with two medical professionals who have a complete understanding of what they're discussing with the community right now, any information that catches your attention, please take the information and run it through your consulting doctors, whatever disease you're parallelly handling along with the CKD. Before you change any medication, please do not change medications based on this talk show that we're running right now. Thank you. That takes us to the next question. The question that this person has put across is a very interesting question, actually. What is the right timeline to take the second dosage? And I have a next question to this question, but let's hear it from.
If it is,
I think Manohar will answer that because he has done some work on that timeline between two vaccines. What is the ideal timeline?
So firstly, again, do not confuse whatever the government says, you listen. There could be so many other things apart from just science involved in designing the schedule. So most important point. So please listen to the government advisories. Covaxin, the Indian Bharat Biotech vaccine, is 4 weeks. No debate on that. Covishield, which is the AstraZeneca collaborated vaccine, it is 6 to 8 weeks, or even there are studies to show 8 to 12 weeks. At 12th week, when they have taken the difference between the first and second dose is 12 weeks or more, then the immune response is better, is what people used to say. This is strict science based on a very high indexed scientific journal. But then this will cause a lot of concerns and confusions among the community. Go by the government. 4 weeks is not bad, but if someone has a choice and is sure that he will get the vaccine at that time, 6 to 8 weeks or 8 to 12 weeks is a better time to take it. But when the cases are on rise like this, I always tell, be prudent and try and take it earlier than later.
Yeah, actually, what Manohar says is very practical. So I took Covishield and I managed to get about 6 weeks time because I'm a healthcare worker, and my own hospital I got after 6 weeks. But when my family took the vaccine, and then I realized at the end of 4 weeks, there is going to be acute shortage of vaccines. The second dose will not be easy to get. And you won't believe, I had to use influence. The hospital was owned by a close friend of mine. So I managed, to be honest, I mean, it's long to say this, I managed to get the second dose. My sister, who was also waiting for 8 to 10 weeks, she could not get the second dose. She had to literally go beg and then get the second dose. So as Manohar says, take the second dose as soon as you possibly get it, because it's not just the science. You also look at the logistic things. So many factors are involved. Because without the second dose, it's not going to be fully effective. It may not be 90%, at least be 70% effective. So go by what the government says, what the protocol says, and take the vaccine. Not taking vaccine is not the answer.
Well, that answer just gave me the third question also to ask. So, if you're going to be taking the second dose earlier than what is scheduled, then what is early in this? 1 week later, 2 weeks later, 3 weeks later?
No. It should preferably after 4 weeks. If you take
4 weeks is the minimum gap, I think.
4 weeks is the minimum time from first dose to second dose. With Covaxin, take it at 4 weeks if it is available. With Covishield, again, science says up to 12 weeks you can wait, and that is better to wait, but go by the consensus which is issued by the government during that time, which can keep changing with time, because we are still accumulating science and also the vaccine shortage and so many other things which we do not want to talk and waste of.
Yeah.
And I think it's only a question of time before we have single dose vaccine, nasal vaccine, all this will come. As Manohar was saying, science is developing. It's only a question of another 3 months, 6 months. We'll have all this variety and then this problem will not be there for us.
Okay. Now that brings me to the second question. What happens if the vaccine is not available between that 4 to 6 weeks time period and we take it later on? Will the efficacy of the vaccine come down, or what do you have to say on that, Doc?
I think as Manohar rightly said, Covaxin 4 weeks, Covishield, we have got a leverage from 4 to 12 weeks.
12 weeks.
So that leverage is there.
Again, there is no data available on this to answer it straight, but take it whenever you get at the earliest beyond 4 weeks.
But other question I think we should also ask, I think maybe I should ask Manohar is, suppose you have taken Covishield and we don't get Covishield, can we take Covaxin second dose or the other way?
Well, again, this is a theoretical answer again. There is no trial which is done to exchange or change the vaccines. It will never be done also. Well, I can't advocate it, but I really don't know what to say about it. Some government bodies have to come up with a solution, but I hope we don't get into that phase. And I'm sure we Indians work and stand up during a crisis period, and we hope we get the vaccines, drugs, beds, oxygen.
I'm asking you a theoretical question. Will it have any harmful? Because somebody told me, my cousin told me, or my nephew, that sir, there was a confusion in my own hospital. I had taken him for having vaccination. He wanted Covaxin. He took Covaxin, but the certificate came as Covishield. But fortunately, because I work in the hospital, I could get it corrected. So he was very worried and angry with me. He said, I have come as a VIP. I said, that is the problem. Because you are a VIP, you are having this problem. But then he told me, thank God you found out. Because all my friends tell me that if you are taking Covaxin and second dose you take Covishield, you will die. I don't think anybody will die. I don't think there's a problem, any side effect of that. It may not work, I suppose. What is your opinion, Manohar?
I'm not sure, sir. There is no real science and study on this, but it should not cause harm.
It should not cause harm. Okay, Marian.
Okay. While we understand it doesn't cause harm, it doesn't mean you can actually explore using two different
vaccines.
Not.
You should not. I think as a dictum, we can say don't change the brand. Take the same. We say the same thing in transplant patients. I tell all my patients who are on transplant immunosuppression, all tacrolimus are all similar. But don't change the brand. And if you're changing the brand, it's like a new transplant. Do some tests and follow. Same way in this also, I would say don't change the brand. If you're taking Covishield first dose, second dose Covishield, Covaxin first dose, second dose also Covaxin. Don't change. That is the answer. Don't change.
Thank you, doctors, for that. This is from a transplanted patient who had a failure. And this is what he has to ask. My kidneys failed due to P-ANCA-associated vasculitis and now on dialysis and has a lot of muscle loss. Is it safe to take the vaccination if I have this?
I think vasculitis and is he also on any treatment, steroids or whatever? Is he taking it? I don't think there's a contraindication for, because he's already back on dialysis. That means his condition is burnt. So most of the time, uremia itself is an immunosuppression, and person who's got vasculitis back on dialysis means the disease is not active. I think he should be able to take. Only thing, because he's on dialysis, he'll be on heparin, which can cause bleeding. So he will have to adjust on a non-dialysis day. Take the vaccine on a non-dialysis day when he's not on heparin. That's my advice.
Okay, if Vinod, if you're still watching this particular live chat, and if you want to ask a few more questions based on your health issues, I'm going to request you to take the opportunity to do it, because in the next few minutes we will come to the end of the show. However, if you watch it later, you can still post your query, and we will connect with Dr. Sundar to see what he has to say.
Sure.
On thank you, Doctor. Doc, the next question that has come up is most people keep asking this. The question that we just did speak about is, if I had COVID, when is the right time to take the next question? And that's one of the questions that are also coming into my personal chat. But I think that question has already been answered. If you've missed it out, then you can.
Manor can say again.
After 2 to 3 months after recovery from COVID, you can take the vaccine. And there is some debate whether one dose should be good enough. Again, for now, you take the 2 doses, but if the science accumulates saying 1 dose is enough, we will inform you by that.
But there's no need to do any RT-PCR, any of the tests before
No.
taking.
No. CRP, RT-PCR are not routinely
Not needed.
Yes.
Doc, here we have a person saying, I had pneumonia and I've taken a pneumonia vaccine on the 23rd of December 2020. My second pneumonia vaccine is due, but I got COVID before that. And now I've recovered from COVID. I have to complete my vaccination. What should be the time gap between taking the Prevena 13 and the COVID vaccination first dose after my recovery, as I am post-transplant 18 years? Would you want me to repeat that question?
He's got too many things. Just because he's post-transplant, I think the protocol is not going to change. And then I would request Manor to answer the complicated question.
2 weeks is the difference between the 2 vaccines. 2 vaccines, one of it is COVID vaccine and the other vaccine, difference to be kept is 2 weeks.
So if he has had COVID, after recovery of COVID, he waits for 8 weeks. 8 weeks, and then probably he can take the influenza vaccine, and then 2 weeks later he can take the COVID vaccine.
Yeah.
Or the other way. But transplant recipient is not going to change the story.
I know. Okay. So here we are only addressing the pneumonia vaccine and the COVID vaccine in the terms of the time gap that is required.
So he has had COVID. So as Manor says, wait for 8 weeks after the COVID is done. Then he can have either the COVID vaccine or influenza vaccine. 2 weeks later, he has the other vaccine like that.
I'm a kidney donor and I have rheumatoid arthritis. Can I take the vaccination?
100%. You should. There's no kidney donor should take, but only thing because of rheumatoid arthritis, maybe as Manor was saying, you can adjust the immunosuppressive if it's not severe. They can stop or reduce the dose and take the vaccine because the kidney donor, not a recipient. So.
Okay. There's somebody who said, well, thank you so much, Sanish, for this question. Nice connecting with you, by the way. Sanish is one of those heroes on the Kidney Warrior group. Somebody who's really inspired me a lot. He's a multi-organ transplant patient. I think he had a kidney and a liver transplant.
Okay.
And he wants to know if he take the vaccination or not. He's afraid.
No, he's, more so because he's a multi-organ liver kidney transplant. He is on immunosuppression, but he should take the vaccine. I don't think there is any reason why you should not take the vaccine. In fact, you should take the vaccine like any transplant recipient, because even though he's double transplant, kidney, liver, he will be on some basic immunosuppression. Because normally those who had a liver transplant, their immunosuppression is much less than the other transplant. Because the liver is something with organ which doesn't get rejected so easily. So they are lucky that we liver transplant. But he will be definitely on some steroids or some tacrolimus. Those things will continue, and you should take the vaccination. There's no this thing on that.
John is the one who asked us, I'm 20 years post-transplant and my CKD, my creatinine is on 2.6. Should I take the vaccination? He's also made an additional point. He's saying, Doc, but I'm on ATT.
I'm on?
ATT.
Anti-tuberculous. ATG or ATT?
Yes.
Huh?
ATT.
I think that Manor will tell you. That has nothing to do with the vaccination per se.
Nothing to do with it. He should take the vaccine.
He should take the vaccine. The ATT is not going to come in the way of the vaccination.
Okay. And of course, we have our very own Sharma ji, who is one of India's oldest transplant patients.
43 years. Pranam Sharma ji, yes. Pranam to you. Namaskar.
And he wants to know, Doc, do I also take the vaccination?
I thought being 43 years transplant, he should be the leader. He should take the vaccine and post in Facebook and say, I have taken. And get into again, Manor, he was in the Guinness Book of Records and Limca Records are the longest transplant recipient from India, 43 years. And he had it in CMC Vellore, where I studied, and my teacher, Dr. Jacob, was also on the show with him. Go with him. So he should take, in my opinion, there's no question at all. He should take.
Um, Doc, is there a right time for a dialysis patient to take the vaccination in terms of before dialysis, post dialysis?
Oh, I would say non-dialysis day. That is the answer.
Non-dialysis day.
Because he's there on heparin. Heparin can cause hematoma. It doesn't cause, the vaccine doesn't cause per se any problem. Because when they put intramuscular this is a story for any injection in a dialysis patient. We tell them take on non-dialysis day. The same story holds here also. Non-dialysis day they can take. But suppose they got sometimes dialysis, they have fever or something, they can avoid that period. But the non-dialysis day.
Okay. So I think we have come to the end of all the queries. We have some of your queries. Yes, Doc?
If Marian permits, I'll just share 2 slides which I made while I was talking.
Sure,
just to be a bit pictorial so that. So I just want to, we are talking only about the vaccines this time. So please look at this picture. On to the left is the people who are not vaccinated. Look at the number of blues who are asymptomatic and look at the number of reds who are severe disease. So on to the right of the screen is the people who have vaccinated and look at the number of blues and there is no red there. If at all, there is a moderate disease there. So is it true? Yes, this is one of the tweets from Gangaram Hospital. 37 doctors of Gangaram Hospital test COVID positive. Like Dr. Sujay Shah has told this, 500 doctors at Gangaram Hospital so have taken the vaccine, only 92.86% is the protection level of it. So 5 are hospitalized, most because of significant comorbidities. So 99% protection from hospitalization. 5 admitted don't have severe disease. So 100% protection from taking vaccine against severe disease. So this is what I was just trying to tell people. So if the slide is clear about if you take vaccine, there is no problem. Please don't debate, vaccinate. So before I close, there's a beautiful simile. I'm sure many of you must have seen it in the WhatsApp groups or the Facebook. The best simile that I could think of for vaccination is seatbelt or our helmet. Does it afford protection? Yes, just like the vaccine. Does it protect you 100%? No, just like the vaccine. Does it prevent you from getting on an accident? No, just like the vaccine. So continue your protective measures of social distancing, masking, and sanitization. If at all we get into an accident, does it reduce severity? Definitely yes, we showed you now. Just like the vaccine, it reduces the severity. Does the seatbelt mean you won't injure others on road? No, you can still injure others. I may have a mild symptom or asymptomatic and I can give it to others. So please continue the precautions. When I wear a seatbelt or a helmet, I think of the company making the money? No. So whichever vaccine is available, please take it. Don't debate on that again. The seatbelt itself cause problems or helmet itself cause problems, hairstyle or the mark or uncomfortable? Yes, to an extent. Just like the vaccine, a tiny pain or a fever, body ache, things like that. So that is a beautiful simile someone has written, and I thought I'll read it out before we close. So don't debate, vaccinate. If in doubt, clear your queries from your doctor.
Thank you, Manohar.
Doc, I have another question, and I hope it's okay to ask the question.
Yes,
just out of
please.
curiosity, for somebody who's taken the first dose of vaccination, and between the first and the second dose of vaccination, they develop COVID. Will the vaccination work to a certain extent that they may not have the severity of the disease? Or if yes, then what percentage?
Yeah, difficult question. Complete or maximum protection against COVID happens 2 weeks post second dose. After the first dose, if you're talking about Covishield vaccine, 57% antibody production happens. After the second dose, it is variable between 70 to 80 odd percentage, depending on what time they take, between 4 weeks to 12 weeks. So I had taken the COVID vaccine and I got the disease. Possibly there could be some benefit of taking the first dose, but it doesn't guarantee anything. Even the second dose doesn't say you will not get COVID. You will definitely have much lesser severe COVID as compared to a person who is not vaccinated.
So after the first dose, they get COVID, then they have to wait for 8 weeks to take the second dose.
Yeah, after they recover, 8 weeks,
8
and
weeks,
then
take the second dose. I think that is the point.
Okay. And that was a question I was going to ask. If they get COVID, how long they would maintain to take the second dose? The next question, yeah, I wanted to ask. So once you take the vaccine, does the vaccine, if you take the vaccine on day number 1 itself, does it begin its effects, or does it take about a week? Because what I understood, what I heard was it takes about 7 to 8 days for the vaccine to actually start its work.
Actually, the fact that you got fever or this thing, that itself shows the vaccine is starting, antibodies being produced. But I'm sure the full effect will take about 2 weeks, isn't it, Manor?
Yeah. That's why many of the tests in diseases, we do it antibody responses in 2 weeks or so. It means if someone wants to reason it out that way. So once you get the vaccine, some amount of antibody production usually happens post 2 weeks after the first dose itself. Maximum protection is post 2 weeks after the second dose.
One other thing I think people are not understanding is it's not just antibodies. There's something called T cell immunity by the vaccine, which cannot be measured. And that also acts against the virus. That is also important to know, that T cell immunity is very important in protecting you from getting a severe COVID infection. And that, unfortunately, we cannot measure. There's no parameters like the B cell, which gives the antibody levels. That is only B cell. But the T cell immunity through the vaccine is much superior than getting only the infection. So that's why the vaccine is important. Yes.
Well, that brings us to the end of the long-awaited topic on the vaccination and all details that go along with it. I'd like to take a big thank you on behalf of the entire community to 2 of my favorite doctors for joining us today and so patiently answering every question. I'm just going to request you one more thing, Doc. If we have further questions on the vaccination, would it be okay if patients tag you all on certain questions on the same chat, and on behalf, will be able to help us with those answers as well?
Sure. Thank you, Marian.
On behalf
thank you, Manoj, for visiting us. Thank you.
Thank you, sir. Thank you, Marian. It was a pleasure to be here. Thank you very much.
Always. Well, before I end this structure, I'm going to tell you guys that we're also going to be starting a vaccination campaign drive, which means everybody who's a part of the Kidney Warrior Foundation, we're going to have our own little Facebook poster come up, and like we did in the fitness event, once you've taken your vaccination, you can click on the link and tell us you are vaccinated, to kind of create this drive of how important it is to take the vaccination. And so be a part of the drive from the Kidney Warrior Foundation. We will talk about the link a little later during the course of the day. You can watch the page for more information, and don't forget, as you take the vaccination, click a picture of yourself and you can use it as your profile picture. You can tag us on it, and we'll just be so happy to know that you're going to be safe during this COVID period. Thank you once again.
Thank you, Marian. Thank you.
Right. Bye. If you don't take a picture and tag it, the vaccine may not work. So do that. Take it. Bye.
Thank you, Dr. Manor. Bye.